Hey parents, so I want to talk to you briefly about medications. So if you choose to go down the medication route, that is up to you. But I don't want you to get frustrated if you tried some meds and it didn't work. So the way they figure out ADHD medications is it's kind of a trial and error thing. Doctors will usually start with a stimulant and then alter it depending on what results you're getting. But here's a list of some of the medications that are commonly used. It's a pretty big list. So it's very normal for your doctor to start with one thing and then increase or decrease the dosage depending on what effects it's having, and then maybe change to something completely different depending on what's happening with your child. So don't get frustrated if you've tried something and it didn't work, and maybe you've tried two different things and it's still not working. That's actually normal. It's part of the process. It's going to take a little while to find the right thing, and it's not a one-size-fits-all situation. As you can see, there are a lot of different medications and they all work in different ways. And even the same medication in a different dosage or in an extended release tab is going to work differently. So make sure that you have an open line of communication with your prescriber and let them know exactly what you're seeing, the good symptoms, the bad symptoms, all of it, so that from there they can tweak and adjust things accordingly. If you don't say anything, they honestly don't know. If you're only giving them the negative side effects, they're not going to go. They're not going to know. If you're only giving them the positive side effects, they're not going to know. So make sure you tell them the good and the bad so that from there they can figure out exactly where to go next. And it might take, up to 6 months to really find the one that fits. So again, this is just a quick little overview of medications and the way that you find the right one. Whether or not you medicate your kids is really up to you and your physician, your teacher, whoever you're dealing with. And know that pills don't teach skills. The medications are going to help with some of the behaviors so that kids can learn better. But you should also be doing other things along with medication in order to teach them all the appropriate strategies and the skills that they need to succeed in life. All right, hope this helps.